Hello friends, today we will have the situation in which after completing the phaco surgery, how to seal the anterior chamber if there is a compromised anterior chamber entry. Now this is a nucleus grade 2 to 3 cataract in a young person who was having steroid for quite some time, and one thing which I would like to comment here is that patient has a little apprehensive. It is the young patient, and young patients usually have heightened senses and they are more apprehensive and they react more to the maneuvers, and they have strong blepharospasm and Bell's eye phenomena. And here we'll see that because of this reason, because the patient was unable to hold the eye in a desired position and some amount of blepharospasm, we have a very short tunnel. Now this may be an issue when the surgery has been finished, because these short tunnels are difficult to seal. So in a situation like this, first thing which should be attempted is hydrating the wound properly, and hydration involves pushing in fluid into the stroma by using a blunt tip cannula, and when the fluid enters into the stroma, the corresponding cornea gets slightly hazy and opaque, and we should try that this haziness and opacity in the cornea reaches on both the ends and it merges and touches each other in the center. This ensures that the whole of the valvular flap is now thicker, and this will provide a better sealing. And as we can see here, it has not helped. Even when the chamber has been formed, it is still leaking. So beyond that, the next thing which can be done is you can try again, but if it doesn't work, then one thing which you can do is place in an air bubble. Now air bubble may seal it better because surface tension of air to fluid interface is higher than just simply fluid. So putting in air bubble may actually help in situations like these, and we can see now the chamber is formed, the air bubble is retained. This air bubble will also keep the wound sealed in a manner that if we now put in some fluid to inflate the anterior chamber, it will work. Placing the air bubble has its own nuances, that it will compromise the vision of the patient immediate post-op period, but it's better than putting a suture to close the wound. So if you find that this is a condition which is acceptable and chamber is maintained, then air bubble can be left inside. And we'll also see the post-op picture in this patient. A larger bubble of air has been injected just to keep the chamber inflated. This is the first day post-op picture. We can see there is slight amount of half of the chamber is filled with air bubble. And this is the 7th day picture, where we can see the air bubble has disappeared and cornea is clear, the pupil is round, and vision at this moment was 6/6 in this eye. Thank you.